Thank you, Wayne, for the introduction, and welcome to our panel here at InsurTech Connect Asia. Our topic for this session is health tech innovation. What's the diagnosis for insurers? There are a lot of critical and unanswered questions that our panel here will help to explore and provide answers to. And it is great to have so many friends and audience members tuned in from all around Asia and all around the world. I'll be your moderator for this session. My name is Ali Medavji, Managing Partner at Blockchain Founders Fund, which invests in and venture builds top-tier startups and consults organizations such as the United Nations. We've got several fantastic insurtech startups such as Jonton, which enables on-demand insurance, and Sigo Seguros, focused on insurance serving the Latino market. I also serve on several public company boards and a senior blockchain fellow at INSEAD. More importantly, we have a phenomenal panel here with us today. We've got Cole Sarusak, CEO and co-founder of DocDoc, with more than 23,000 contracted doctors, and he is an entrepreneur in residence at INSEAD. We've got Kalai Natarajan, General Manager, DX and Innovation at Dai-Chi Life Insurance, and she previously held senior roles at Visa and Prudential. And last but not least, we have Rosalind Chow Koo, CEO and founder of CXA Group, which has been awarded InsurTech of the Year, and she's received the Top CEO Award by Influential Brands. Now, it's a pleasure to have each of you here to share insights with our audience. And I want to kick this off first with, the big elephant in the room around COVID-19, which has, of course, been impacting businesses and lives of nearly everyone on the planet. Now, I don't want to spend too long on this topic, but Cole, set the scene for us. How has COVID-19 driven health tech innovation for players like DocDoc?
How has it impacted?
Correct.
So I think it will remain to be seen how much of a lasting impact happens. So lockdowns were kind of an absolute. And when the region locked down, anything that was B2C that could help ease the lockdown around medical care did remarkably well. I think that just kind of across the board. And I also think that a lot of the legacy infrastructure that had been buried in the insurance industry, really that the inadequacies of that in a virtual environment really became very, very clear to a lot of players. So things like things we take for granted, like being in the cloud. A lot of groups were not in the cloud. A lot of groups had no ways to deal with their agents. A lot of agents had no ways to deal with their clients. I mean, it really ground to a halt a lot of the back end of a lot of insurance. That's one area. It also ground to a halt a tremendous amount of elective and semi-elective procedures in the hospitals. And a lot of things moved to telemedicine. Interestingly enough, the vast majority of telemedicine that happened during COVID period was actually done on POTS, plain old telephone lines. So it wasn't actually done with any kind of a new wave system. In fact, telemedicine, it looks like the most preferred way to do it is over the phone. People prefer that to a Zoom call, which was surprising. The best data I saw came out of Australia, where 92% of all telemedicine visits were done by phone. So, the trick in digital health and the trick in insurtech is about figuring out how to integrate into very, very legacy systems. And so COVID has helped in that I think if it's helped anywhere in terms of transitioning the industry longer term, it's going to be helping the industry. The regulators have gotten a wake-up call. The regulators, look what's happening in Singapore right after. We're in the middle of COVID, and they've issued a massive RFP to redo the claims infrastructure in conjunction with the Insurance Association. Why'd they do that? They did that because when they realized how truly legacy the systems had become, they said, we have to start somewhere. So I think that the biggest change of COVID long-term is going to be the regulators insisting that the incumbents innovate, because the incumbents are actually showing to be remarkably resistant to change.
Wow, that's very insightful. Kalai, what about for insurers? How has health tech during COVID-19 changed aspects for say your firm, Daiichi?
So I'll speak broadly about what I've witnessed in the industry. To Cole's point, yes, there is there was a bit of a rush to figure out how to conduct business on an ongoing basis, given some of the limitations and some of the resistance to his point about not wanting to change existing systems and existing ways of doing business. So it is an industry that has thrived on face-to-face discussions and face-to-face interactions as well as relationships. And then suddenly we had to transform quickly into doing business remotely. Most companies cobble something together, which is usually a combination of Zoom or telephone calls while having to meet all the regulatory requirements and still dispatching a set of documents through, courier in order to complete a sale. So this was not really a good experience for the customer, and definitely there was an impact on business. So is it really like expediting some of the modernization, digitalization that the insurance companies should have done? Absolutely. But from a patient standpoint, a couple of things also became apparent. There was suddenly a demand for insurance companies to cover telemedicine consultations. So in the group insurance space, typically most companies do not have telemedicine as an offering. And even if a customer or rather an employee went and consulted a doctor through a telemedicine service, it typically isn't covered by group insurance. So the one thing that we noticed that was in the group insurance space where employers wanted coverage for the employees to actually do telemedicine consultation rather than visiting a doctor face to face. So yes, we started seeing some change in that area. Now, whether this is going to be a lasting change is yet to be seen, because if patients have become very comfortable and very confident doing a telemedicine consultation, whether it's through phone, through an application, having their medication delivered to home, rather than having to get dressed to go out to potentially expose themselves to an infection. That drive was there, but it's really a matter of like whether that's going to sustain once all the dust settles. Now, when it comes to the modernization of the industry, now I think there's no going back on that, because the industry has already witnessed a major impact to business, and the ways we have been doing business has to change, because face to face is no longer always viable. And if customers and agents and distribution has already had a taste of doing business remotely without having to sit in front of a customer, then it might be a situation where this change is here to change instead of going back to what it used to be, because those changes will last.
Wow, that's interesting. And Rosalind, I'm curious on your thoughts and insights here, especially in relation to CXA. Yeah, maybe you could touch on that.
Yeah, I agree with both Kalai and Cole. We used to have two different types of business. One was face-to-face, and they were brokerage firms in 3 different countries. We saw a massive stalling of face-to-face, except in China, which ramped up pretty quickly. What we did see in our tech business, where we white label for insurance companies, is a massive urgency to digitize. So for the insurers, we actually digitized their end-to-end group insurance, built the ability for their clients to actually tailor insurance to each employee, and we integrated straight into the teledocs, straight into the clinic management software instead of TPAs, so that we can get the diagnosis and the prescription directly to the health screeners, so we can actually get the biomarkers, and directly into disease management providers and wellness. So we saw a massive focus on health, and we were required by insurers to actually build out their insurance end-to-end plus their ecosystem providers, so that we could eliminate all the middlemen, because all the middlemen were face-to-face. So we eliminated brokers, we eliminated agents, we eliminated TPAs in order to bring the price down. So in 4 different countries, we built the entire plumbing so that these insurers can actually distribute directly to their clients without middlemen, but also via their bank partners, their payroll partners, their telco partners. So we became a digital platform and ecosystem for them, capturing all the data. So COVID was big for us. And it's both online and offline. So we became an enabler for the insurers.
Wow. So it sounds like this period of COVID-19 was busier than ever for you.
It was absolutely not for a brokerage, right, which I've sold off, but for the tech infrastructure to become a bank assurance platform, it was super busy. So that part of our business went crazy while the brokerage just stalled. So I sold off the brokerage in order to work for the insurers because I don't think they're going back. They've decided this was it.
Wow. So, from that, we heard that, regulators are going to get more serious around looking at modernizing some of these systems and working with some of the main incumbents, looking at eliminating middlemen, which I think was quite interesting, and looking at how that's impacted brokers and other players as part of that. Now, I want to move over to this emergence of health data, looking at technologies, leveraging machine learning or other emerging technologies, and using those for insights for better patient care and potentially for insurers to leverage potentially lower claims, premiums, or sort of, reduce claims, any of those sort of aspects on health data. Now, I want to start with you, Kalai. What are you seeing in terms of how insurers are using this increase in emergence in health data and even pairing it with technologies like machine learning?
The interesting thing here is that, excuse me, the interesting thing here is that insurance companies always had health data. If you ever bought a health or a life insurance product, you have to fill up a questionnaire that's probably like 5 pages long with 70 different questions in subsections. The information gets gathered, but has the industry effectively used the information is the question. So typically, I think, any actuary will tell you that they will use, maybe like 5 data points, age, gender, ethnicity, whether you're a smoker or not, and certain lifestyle questions on, how many glasses of wine or pints of alcohol or beer that you drink. Underwriting has only used minimal data. The question always remains, what are we doing with the rest of the data? So it's now a situation where it's not a matter of whether we lack the data availability is there. Question here is whether we have stored the data, whether we have permission to use the data, and whether the data is structured enough for it to be of use to the new use cases we could potentially develop. So number one is, where is the rest of the data we've collected over the years sitting? What state is it in? And then for us to then start looking at whether this data can be used. If we can establish that, then it's a matter of then designing certain new use cases for data. Now, where will we use this additional data? Underwriting can be a lot more refined versus the current situation. So, for example, today I will be underwritten based on just few factors. Like I said, my age, my ethnicity, and my gender, and some of the lifestyle habits. But I am not a regular person if I'm not a regular person of this particular age profile, my premium is not going to be any different from the next person who may be, have a higher BMI, worse lifestyle habits, lack of exercise, etc., etc. So one area where this data can be used for the insurance industry is to refine the underwriting so that people are underwritten more for their profile and their psychographic definition rather than just some kind of like a very archaic ways of just looking at gender, age, etc. The couple of other areas that we could be looking at, of course, is to predict the future. So we can actually, sort of do crystal ball gazing, and that's what the actuaries do anyway, to see in the past, if people of certain profile, when does it start becoming a business that starts paying out? So in this area, we can actually do some kind of predictive modeling by saying that people of this nature start, claiming at a certain stage and a certain age and in a certain situation in their life. So we could do more of that. But the part that is really interesting is how do we then, manage this customer depending on the propensity to get sick and start becoming a burden on the system or whether whoever the payer may be. So that kind of data modeling is something that the insurers have not really looked into, because frankly, managing claims down is not top of mind for a lot of insurance companies still. We're still looking at customer acquisition. So how do we offer value to the customer to acquire them? Because it is a business that has got a very long gestational period, chances are we probably will come into that crunch mode a little later. The more informed companies could actually be looking at their books today to say that 20, 30, 40 years from now, this is the kind of claims that is going to come through because of a certain customer profile that we have actually underwritten. Now, what can we do today to avoid that? That is future state, but that I'm not sure whether any insurer is already doing effectively in this region, because it looks like a problem that is yet to arrive.
Very interesting. And I think, that was insightful on, some of the archaic ways that, insurance companies are looking at these demographics. But Cole, I want to move to you and sort of hear about how some of this emergence of data, it has sort of really started to change things. So for example, there's technologies now to monitor patient health to reduce hospital and GP admissions, or and there's many other sort of examples of different areas where these technologies can either help the patient or even improve and optimize, the hospital side, et cetera. Are you seeing patients demand this sort of technology? Are doctors able to keep up, with all of these changes? And how is this really leading to better care?
Well, there's a variety of things here that are being said. There's a disconnect the size of the Grand Canyon between the innovation arms of insurers and what's theoretically possible and what's actually happening in the workflows of their day-to-day operations. And I can't even begin to articulate that gulf. And for all the entrepreneurs on this call, you have to get to know the guys that are actually in the insurers doing the real work to really understand where they are, because only when you understand their actual workflow and the extent that they are dependent on legacy systems can you begin to do anything impactful. If not, you'll get caught in the innovation, what I call it innovation theater, and you'll win a business plan contest, you'll win some awards, and then nothing happens because the ultimate decision makers just clip, not going to do that, and here's why. And so I've lived this a bunch, and a lot of my friends in the industry have lived it too. And so let me give you just a little bit of an insight into when people say digital, the disconnect between the blockchain world and what we're talking about in health claims processing. So if an insurer is ingesting a claim from a fax machine to a PDF to a record that they attach it to, would you consider that digital? Is there anything about that that's actually the digital age? There's not. All that data is stored as what they call data debt in the real world of data science. It's all data debt. Will never be unearthed by anybody but a human, and will never be based with analytics to drive anything. That's the top of the line of insurance analytics from claims in Asia today. That's the top, tippity top, right? Nobody's building knowledge architectures that are absorbing data in machine readable ways tied to known concepts that can then run analytics on it to begin to make very basic decisions, right? So it's miles and miles and miles away. Now, there's also a real reticence in the industry from actuaries who want that data, because if you gave them really high quality structured data, they would really have to be doing some deeply creative and difficult work to begin to say, what does that mean? Because historically, and Calais was very forthright about this. Historically, the insurers in Asia have been totally focused on customer acquisition, because what they've been telling the industry and what they've been telling Wall Street is, guys, we know we're losing money today on the initial customer, but don't worry, it's an emerging middle class. Asia's really interesting, and they're all going to stick with us, and we're going to sell them more policies down the road. So fine, our combined ratio is a negative 120% on the first policy, but the second and third and 5 years out, this is a good looking customer for us. The problem is that Wall Street is starting to realize that's not true. They don't have the lifetime value that they've been telling the street. They're not actually innovating with technology that prevents churn because of a better customer experience. They're not building sticky data architecture. I mean, they're just simply not. And this really hit home a couple of weeks ago when I had one of the world's leading equity research analysts from one of the top banks call me, and he said, "Cole, can we talk?" And I'm like, "Sure, what do you want to talk about?" He said, "Well, I've seen you on a bunch of panels dealing with insurance tech, and I want to find out what's really happening in Asian insurance. What are they really doing? Because this is their equity narrative that they're telling me. The CEOs are telling me they're doing this. They have, and I don't need to get specific, but they have this new ecosystem, that new ecosystem. And this is how I have to tie it into my model to actually hit this lifetime value argument." I said, "Well, none of that's real. I mean, you can dig into it. They're not building the underlying train tracks that are necessary to ingest the data in a way that it can be used." And so then it was illuminating to me to see where that disconnect's happening. I don't know what's going to happen next. I don't know if we're going to see a bunch of disruptive insurers start in Asia that are going to force the actual hard yards to make it start happening, or if it's just or the regulator's going to drive it. But I'm telling you, the incumbents are not innovating, straight up, not even close. I don't even mean to be difficult. It's just not. We don't even have to go much further.
No, yeah, I'll respond to that. It's like I said. I take the point that the biggest challenge that the incumbents are facing is that they will start an innovation team, and the innovation team by far and large sits separate from the rest of the business. I think as long as innovation teams remain a separate bunch of people that do some strange things and drink craft beer and play pool in the office, I think it's just not going to move into the mainstream business. Where the change will start to happen, and we are beginning to see this happening, is the innovation sits as part of the business, whether it's sitting in operations, distribution, where somebody actually looks at it and goes like, "Why are we still using paper-based forms?" And then we invest in systems to convert the paper-based form into something that is readable, and that system takes a life of its own, and then suddenly the paper forms never go away. So it's also a matter of like somebody sitting there going like, "Okay, we draw the line here, no more paper forms." So when we are actually capturing information digitally that goes directly into the system, it is the first step towards actually capturing data that is then structured, usable, and then from there we start developing use cases. If the innovation team sits outside of that actual workflow, and we still stick to paper forms, and we still look at acquisition and sales as the key drivers of digitization, the type of things that we are discussing here, it will not come into fruition. How many of them have done it well? I can't tell, but the fact is that the insurance company
zero. Well, I can tell you for sure, none.
Yeah. So I speak from having observed it from as an insider, and the part here is that I think in any innovation, like the innovators come in to say that, "Oh, we're going to eat your business." The incumbents go like, "Oh, we've got too much money, we will kill you off." I hope that we've come to a stage where we are part of the same ecosystem as the enabler, as the patient, as the payer, as the provider. And if we were to start looking at the industry as a whole, the way payments did, the way banking did, I think there's a lot that can be done. But like I said, the innovation needs to sit as part of the core business. The minute we draw the line, it won't move forward. And I agree with that.
Now, Rosalind, I'm curious on your thoughts on this just briefly, because I mean, CXA has been quite innovative compared to many counterparts. So I'd love to hear your thoughts.
So I used to run an insurer and I ran a broker. I'm from the industry. So we don't work with innovation teams. We work with the core group insurance, voluntary insurance, personal lines heads, and their ops people, and we capture data from the source in a structured way, and they're using our data warehouse where we capture from the HR, from the employees, right? From the clinic software itself, not data entry, but from the clinic software, from the lab raw data files, right? And from our apps. So we're not working with the innovation team because sometimes they don't really know what's going on. I mean, they're in some fantasy land with digital lipstick, right? So we actually work with the core teams because we're first working on customer acquisition. And then once we get, the SMEs of all the banks in, how do you cross-sell each employee with insurance, group, personal lines, and voluntary benefits, right? While they're going through their journey of seeing their doctors, getting their health screening, going to the gym, doing their diabetes. So we have to work with the core team because otherwise we get nowhere, right? These projects will just go to pot and do nothing, right? So it is core to the business, and that's how we've been working. So when we work with the insurer and the bank, it's head of commercial banking, right? Head of retail banking, head of private banking, and the group insurance guys, the voluntary insurance guys. So because I'm from the industry, I have to work inside. And we have to digitize every single piece of paper because it has to be structured data. So, and we can capture at an individual level their health screening, their age, gender, their diagnosis, their drugs, right? Their lifestyle, all in one. Then right? Then you know what to recommend.
So I want to go into
a benefits wallet for them so that they can decide. So, and they get incentivized if they get healthier. So I see both sides. I'm from the industry and I started a startup to help the industry because I know all the insides. I'm from the guts of the organization.
So I want to quickly sort of relate to that, right? So we've got these new technologies coming out. I mean, there's rumors of a new Apple Watch that's going to have advanced sensors to monitor glucose levels in real time.
That's true.
There's plenty of other technologies that are going to be giving this incredible abundance, of data. Now, Kalai, is that going to help lower premiums, or how do you foresee this being used? And then we've got to wrap up sort of after that.
Right. So I think what it will do, and this technology already exists, whether it's in a convenient form of an Apple Watch or not, you can check your HbA1c on a daily basis. You can check your blood pressure on a daily basis. So what this will do is that today, if somebody is borderline diabetic, the loading on the insurance is so high that it's forbidding. And it does two things. One is that we completely cut out a group of patients from ever becoming insurance customers. And number two, the person actually has got no help, no support, no medical care unless it's out of pocket. And chances are the disease will escalate very quickly, leading to the person comorbidities and eventually mortality. What this could do is it actually incentivizes people to perhaps make changes in their lifestyle so that they actually do become insurable. So if I'm borderline diabetic and I'm able to wear this Apple Watch and sort of transmit the reading on a daily basis to my insurer saying that, hey, I'm doing all the right things, I'm bringing my HbA1c down, and I have put the disease into remission. If you're able to illustrate that, there's no reason why the insurance company shouldn't give this person a second chance. That is where I think this data could go, and it could help both the insurer to capture an audience that we otherwise may never have been able to bring on board, and it also increases and improves the overall health of individuals as well as communities. So I think that's where this type of data using technology and easy delivery could take us.
Now, this is a fascinating discussion. I wish we had so much longer, to dive even deeper into this. But, I think some of the themes that came out is there needs to continue to be innovation to drive the underlying infrastructure. Some of this emerging technology is helping innovation, but there's many challenges as we discussed over the panel. Now, this has been a very insightful discussion. Thank you to our incredible panel. And I can personally say I've learned a lot, and I'm sure our audience will agree as well. I'm encouraged by the transformation, the potential of the technologies, here. And now there are many other incredible presentations and panels from experts all around the world remaining today at InsurTech Connect Asia. What better time to be able to learn from all of these individuals from the comfort of your own home, including sessions on insurance value chain, parametric insurance, and closing the digital gap around customers. So be sure to check them out. And thank you again to our incredible panelists for making the time to share your insights here today.
Thank you for having us.